Hello, and thanks for joining us. I'm Veronica Harper. I'm here today with Michele Erikson, Executive Director for Wisconsin Literacy, and Dr. Paul Smith, Director of the Wisconsin Research and Education Network. And they are both here today to speak with us about health literacy. Thank you both for joining us.
Thanks for having us.
Yep, glad to be here.
So for our viewers, could you briefly explain what exactly is health literacy?
In its simplest form, health literacy is the ability to understand and act on health information.
And how does that differ from literacy?
Well, literacy is defined as a person's ability to read and write in order to function in their community. Health literacy plays out in many different areas of our healthcare system, and it occurs when individuals fall short of the demands that the healthcare system places on them in order to find, to understand, and then to use health information.
So Paul, why do you feel that health literacy is so important?
Well, research has shown that people with low health literacy have poorer health knowledge, poorer health status, they tend to use preventive services less often, and they have an increased chance of dying at a younger age. They also tend to go to the emergency room more often and end up in the hospital more frequently, and that increases healthcare costs.
So if you could just briefly tell me a little bit more about where and when the summit is going to be held this year.
The 4th Biennial Wisconsin Health Literacy Summit will be held in Madison at the Alliant Energy Center, and it will be on April 12th and 13th. We will have a couple pre-summit workshops that will occur on the 10th and 11th of April, and they will focus on writing plain language materials, and will be conducted by an organization called Plain Language Works. And we'll also have a workshop that will focus on helping different state initiatives build their capacity to continue work in this field.
And so I understand this year you have some very exciting presenters. Who are some of the keynote speakers?
We are really excited by our all-star lineup of featured speakers this year. We'll have our 2 keynote speakers will feature Dr. Richard Carmona, the former U.S. Surgeon General, and we'll have our former governor and former Health and Human Services Secretary, Tommy Thompson. We'll also hear from Dr. Darren DeWalt, Dr. Andrew Pleasant, and Dr. Michael Wolf, who are top researchers and authors in this field. And we'll also hear from Kavita Patel, who's a former policy director, health policy director in the Obama administration, and she'll talk about the opportunity for health literacy in this age of healthcare reform.
And also you have a number of different workshops, like 30 workshops or so? Or?
We do. We have 36 different workshops and information sessions, and they will focus around 5 different tracks. So we'll have a track for healthcare professionals, one for adult literacy professionals, we'll have one for health educators, health writers, and librarians, and we'll have one for community-based organizations that work with vulnerable populations. And then finally, we'll have a general health literacy session and information about health literacy special projects.
And so what do you feel are some of the important takeaways for this year's summit?
Well, most of our speakers are going to be talking about health literacy practices, tools, interventions, and project experiences. So we hope that conference attendees will take what they learn and start to apply it in their own daily job, or work to change policies and procedures in their organizations to address health literacy issues.
Paul and Michele, any last thoughts for our viewers?
Well, I think the Health Literacy Summit is going to be a really unique opportunity to learn about health literacy initiatives throughout the United States and to hear from some of the top leaders in this new and emerging field.
We really have a wonderful lineup of national, regional, and local speakers with topics that will appeal to anybody with an interest in health literacy, regardless of their background or their profession. With so many presentations about what people can do about health literacy, we believe that everyone in the audience will find something they can use when they go home to work on improving health literacy to improve the lives of the people they serve.
Well, it certainly sounds like it's going to be an exciting summit this year, and I'd like to thank both of you today for joining us. And if you have any further questions, please log on to the Wisconsin Research and Education Network website or the Health Literacy Wisconsin website. Thanks for joining us.